All right. Apologies for that break in transmission. We always say technology makes life very, very good. It makes life easy, but sometimes technology can actually create problems. We had tested every aspect of, our technology, and everything was working well. But just 10 minutes into our transmission, then we lose transmission, which is not something that is good, but apologies for that. Let me start afresh. Maybe we will do it better this time. My name is Fundi Lenyati. I'm the host of this channel, the Dr. Fundi channel. I've got a special guest today, Ms. Ritabile Matolweni, who is a qualified occupational therapist, somebody who's very passionate on matters of disability in the workplace, but also beyond the workplace. I've invited her today to be my guest because 3 days ago, it was World Stroke Awareness Day. And as a result of that, I felt we needed to have a special broadcast on that particular topic. Now, the focus for most media companies, that is radio and TV, has been on the medical component of strokes. And there's one area of the strokes that has not really been given due attention, and that is the rehabilitation of the survivors after they have, gone through a situation of a stroke. So we are going to spend a lot of time focusing on that area. Now, before we had the break in transmission, I just went through a research that was done and published on the South African Journal of Physiotherapists on the 22nd of July last year. A research that was done by Mokhabadibe V. Ntsiye, and it's on this. It was on this South African Journal of Physiotherapists. She was actually, focusing on the issue of current stroke rehabilitation services in South Africa. And what she found as an intro or background to that study was that strokes are the most common causes or one of the most common causes of morbidity and disability in South Africa, with the burden of stroke particularly high in rural South Africa. Her study was a 10-year narrative review of stroke rehabilitation research in South Africa. And what she came up with, or her conclusions, were that stroke survivors in South Africa have poor functional from hospitals. She also found that stroke survivors have poor access to transport, work, and education. Caregivers also experience a lot of strain and have poor quality of life. And in the South African context, caregivers are normally family members. Inpatient rehab services in South Africa focus mainly on medical model approach. And that patients who are discharged to family care because of limited rehab services within hospitals. There's early discharge, and the discharge is actually to lay people in the communities. And she also felt that caregiver education alone and the use of pictorial exercise programs does not improve the functional ability of patients, and also it does not contribute to adherence to the exercise programs. So that's what she said, and I'll share other points here. But one thing that became clear, though, was that the prevalence of strokes in South Africa is actually on the rise. Because on a study that was done in 2013, study that was done actually in 2003 by Bertram and others, they found that yearly we had 75,000 people with strokes. All right, that was 17 years ago. The Heart and Stroke Foundation of South Africa now talks about 240 people per day, 10 people per hour, which makes it 87,600 people per annum. So that's an increase of more than 10,000 cases per year from what it was 17 years ago. What also was found was that the average age group of people with strokes in South Africa We normally think that strokes are just for people who are older, above the age of 65. But what they found was that 45% of patients with strokes in South Africa are below the ages of 65. And 27%, that is just over a quarter of patients with strokes, are below the ages of 55. And the average age in South Africa of people with strokes is 51. So with me being 53, I'm definitely in that high risk zone. So therefore, strokes are no longer considered a disease of old people. All right. And because younger people are affected by strokes more and more, it's got a much more devastating impact on younger survivors because of the number of years of social and economic activity that they still have to live as compared to older people. And therefore, younger people with strokes need more rehab to enable them to be fully integrated into community and work. With that long introduction, Ms. Matolweni, welcome again.
Thank you, Dr. Nyati, and thank you for having me in your show again.
All right. So I've just shared this information that the issue of strokes is becoming a bigger problem. If we look at 2003 and the current situation, younger people are becoming affected more than it was before. So from your insights and your experience, do you share the same views around the problem of strokes in South Africa?
Thanks. Allow me to call you Bele because this isn't how I know you. Thanks, Bele. Yes, indeed it is. You must appreciate the fact that strokes, most of the strokes, are as a result of a complication in most of these underlying what you call diseases of lifestyle. So it could be hypertension, it could be diabetes, and therefore it's not just isolated. So we're seeing that our lifestyles are making us more prone or more susceptible to issues of your hypertension, be it the food that you're consuming and the fact that we're not as active, and also on the issues of diabetes. So if you're looking at those diseases alone, you can see that then because stroke is a complication of some of these diseases, or it's closely linked, if I may say so. So you'd find someone that they've had a stroke because they've got a history of hypertension. So that correlation then would then be much more evident. So it would not rise on its own. It would rise on the fact that we grew up with the idea that only old people would have hypertension, but we're seeing it in our age groups and even younger, same as diabetes, that only older people would have diabetes. But then also we're seeing that also the same picture within groups that are younger, and therefore stroke then would not then be, would then follow the same narrative or the same pattern as other diseases of lifestyle.
Lovely. All right. So our approach on this conversation will just deal briefly with the basics on the medical side. All right. But that's not why I invited you here. All right. That I could have done on my own. But I've invited you for the other part, which is the more important part in terms of ensuring, continuation of economic productivity, especially amongst those who are younger, who still have a long way to go, All right. So, but just to kickstart the discussion then, on the technicalities now, how would you define a stroke? What is a stroke from your perspective? Yeah.
Okay, I would define a stroke, Bele, as a death in inverted commas or an injury in a particular part of the brain. The brain has got several areas, and then one of those areas is what we call the cortex, with so many regions. And that death is normally referred to as an infarct, and it is caused by an interruption in the blood supply of that area. So that interruption can be caused by a blockage in the vessels that are supplying that infarct. It gives us what we call ischemic stroke, and the high number of strokes then would then be your ischemic strokes, which is about 70 to 80%. You'll correct me. Or the interruption of the blood supply would then be caused by the rupture of the blood vessel itself, what we then we call hemorrhagic stroke, much more deadly, much more dramatic, but less in terms of numbers. So you've got almost two types of a stroke, ischemic and hemorrhagic stroke, but then the resultant is that the areas that where there's blockage in that blood supply or where there's rupture in that blood vessel would then result in the death of that area, and we call that an infarct.
Right.
Now, if you're looking at the nervous system, I'm going to try to avoid being technical, but there's no ways we can't avoid it in a topic such as this one. If you're looking at the nervous system, we've got what we call the nerve tracts or the neural tracts. So you'll have a stroke on the right side of the brain, but because just below the base of your head, you've got the crossing of the nerve tracts, such that then those that are coming from the right side of the body will go to the left of the brain, will actually run through the left side and vice versa. So if you've got a stroke on the right cortical area, then you then
That's
have...
the left, that's the left, Ma'am Tol.
Oh, is it the left? You see, if I had a ring, I would know. So on the left cortical area, then we'll have what we call a right paralysis. So strokes are normally referred to on the side where the paralysis is. So you'll hear that Mam Dola has suffered a right hemiplegia, but then the infarct is on the left side of the body, and vice versa. So I think that is the most basic way of describing a stroke, as an infarct in the brain resulting from a blockage or the rupture of a blood vessel supplying that area in the brain.
So it is actually a medical emergency.
It is a medical emergency. It is
Yeah.
a medical emergency. I know my medical colleagues call it a fast approach in terms of when a stroke occurs. So what happens when a stroke occurs and you are sitting home? A person would have their faces, there'll be just this acute paralysis of the face, the arm would drop, which is another acronym for fast. So you'd ask a person to lift up their arms, they can't lift up their arms, and then the issues of speech, you'd ask them to repeat what you're saying, the speech is slurred, it's very difficult to articulate some of the names or the phrases, and obviously the last part on the T is then the time. So you rightfully or correctly say that a stroke is a medical emergency. So as soon as then we see those symptoms, a person will be rushed into a medical casualty center, and most of all medical casualty centers would have their protocols in terms of managing a stroke, and these protocols are getting advanced as time with the progress of time. I know a very dear friend or a colleague of mine is an emergency doctor. She was describing to me the procedure around detrombolize patient. So because it's a clot, so a patient needs to be detrombolized, and issues of time then becomes utmost critical.
You're moving very fast, Mam Tolo. You can see that this is a subject that you are very passionate about. You see, because I just asked you to define a stroke, and now you've just taken over, Nji.
You spoke about time, so I needed to explain on the medical emergency aspect.
Right. But anyway, no, that's fine. So you've defined what a stroke is, interruption of blood supply to a part of the brain, either due to a clot within the artery or blood vessel, or a rupture of the blood vessel. And you said the majority of the cases are those that are as a result of Ms. Matolu,
Yes, sir.
I
You see,
think
today is not our day.
no, there is a storm outside. It has
Mm.
interfered with with the transmission, but I'm glad that you are still there. I have to apologize for the second time for the break in transmission. That actually gives an impression that one is amateurish in terms of how one is conducting this thing. But anyway, sometimes technology has got that
Mhm.
situation of just disrupting us when we are doing important things. But we're not going to give up. We will continue because people need to be, informed about these topics, and we will soldier on despite the challenges of
Dr.
technology.
Nyati,
Right. So I was just summarizing your definition and the fact that you said the majority of people with strokes are those who've